If you have type 2 diabetes and you want to lower your A1c, listen carefully. I'm Dr. Isabel from my Dr. Diabetes Internal Medicine Doctor and Diabetes Specialist. Diabetes management is much more than just sugar. It's important for you to understand all the other factors that are involved in diabetes management so you can lower your risks. I want to share with you how I approach patients with type 2 diabetes. You can click on the link and you can download my roadmap to type 2 diabetes management. So let's start with diet. Diet is not just about the amount of carbs that you eat. We have to address one of the main drivers of most patients with type 2 diabetes, which is an excess in adiposity. Adiposity interferes with insulin action and produces insulin resistance. So we need to decrease your adipose tissue. And how do we do that? Reducing your caloric intake in your diet. We also need to address other items such as ultra-processed food, the amount of fiber, the amount of protein, the quality of the fat, the oils that you are eating. All those things are part of your meal plan. Another thing that needs to be addressed is your physical activity, the amount of muscle and how active it is. It's the muscle that takes that glucose from your bloodstream after you eat. So if you have an active muscle and you have enough muscle, you will be more insulin sensitive. How do we do that? Well, with both aerobic training and also resistance training. So people with type 2 diabetes have to make sure that they keep themselves physically active. And because high blood sugars impact your vascular system, they put you at a higher risk of developing a cardiovascular disease such as a stroke or a heart attack. And we don't want that. So we need to take care of other risk factors such as your lipids and your blood pressure. That's where statins come in. Statins have been shown to reduce very successfully your cardiovascular risk. So most people with type 2 diabetes should be receiving a statin. The dose will depend on whether you have had a previous cardiovascular event. People with diabetes are more likely to develop hypertension because there is a sodium retention in insulin resistance. So it's not unusual to have people with 1, 2, or even 3 medications to manage hypertension. Let's talk about glucose. Not everybody will react equally when they eat carbohydrates. Some will produce a high glucose level in their bloodstream and some will not. It will depend on the capacity of your pancreas to keep secreting insulin and on your muscle capacity to take in that glucose from your bloodstream. Remember we talked about physical activity? Should all patients with type 2 diabetes use glucose meters or glucose sensors? Although they are usually considered necessary in patients who are using insulin, they are very educational in patients who are not. They let patients get to know how they react to certain foods and certain activities, so it is a helpful tool. Let's not forget about cigarette smoking. Tobacco is not just another health factor for cardiovascular disease. It also increases your insulin resistance and furthermore, your insulin requirements if you are using insulin. So that is another factor that needs to be considered. And one last thing that I want to mention is mental health. There's a clear association between patients with mental health who develop type 2 diabetes and patients with type 2 diabetes that develop mental health issues. Why? Because diabetes involves pretty much every decision you make throughout the day. There are so many other concerns like what's going to happen to my eyes, what's going to happen with my wound, what's going to happen with my kidneys. So all of that leads to what is called diabetes stress. And diabetes stress can interfere with you taking your medicine, going to the doctor, getting your exercise, following your diet. All those things may be affected when you are stressed because of your diabetes. So this is just an overview of all the things that we need to discuss when we have a patient with type 2 diabetes. It's not just about your A1c and how much sugar you are eating. I hope this is not scaring you. I very much hope that this is helping you Walk in the right direction and get your A1c under control. And don't forget to click on the link so you can find my roadmap. Keep learning diabetes with my Dr. Diabetes. See you soon.